Have you ever looked at the symbols printed in capital letters on your driver's license? I hope everyone here knows that these are blood type symbols. These are symbols that everyone has in mind, but forgets when the time comes. But here's the thing, what if I told you that, according to this blood type scale we tend to overlook, there are differences in how the immune system reacts, how quickly blood clots, and how well the digestive system is protected against certain bacteria? Yes, these are facts. I'm not going to talk about astrology here. I'll be discussing decades of scientific research, and in addition, we'll examine the characteristics of blood groups 0, A, B, and AB, the risks you need to be aware of, and their biological profiles, one by one. Are you ready to be surprised when you hear about the characteristics of your own blood group? Let's get started then. The Antigen System. Before diving into the topic, we need to understand the basic mechanism. Why, you might ask? Because the solutions only make sense once we know this, so don't skip this part. Now, let's imagine our red blood cells. Picture a pool. The pool is completely filled with red water, and there are white balls floating on top of this red water. On the surface of these balls is a structure we call an antigen. So what is this structure, and what does it do? Think of this structure as a biological Velcro strip. If you have type A blood, you have an A-type adhesive. If you have type B blood, you have a B-type adhesive. If you have type O blood, the surface is completely smooth. There is no antigen. So what's the significance of this? Some viruses and bacteria have evolved to bind to specific antigens. If there's an organism that can attach to the antigen structure in your blood, your immune system struggles to establish a defense line. Additionally, the structure we call an antigen is what helps the blood clot when you cut yourself. Blood type 0. It accounts for 40% of the world's population, and it would not be wrong to call it the most common blood type. This blood type has lower levels of a protein called von Willebrand factor, which acts as a clotting agent. This indicates that clotting occurs more slowly. This characteristic provides a protective effect against deep vein thrombosis and similar circulatory crises, but requires extra caution during major surgical procedures. Additionally, the H antigen on the surface of type 0 blood facilitates the binding of certain stomach bacteria, particularly Helicobacter pylori. For this reason, individuals with blood type 0 are more likely to experience ulcers in the stomach and ulcers and inflammation in the small intestine. If you have this blood type and these issues have arisen, what can you do? If you're experiencing heartburn or indigestion, don't put it off. See a doctor and be sure to mention your blood type. Additionally, I recommend avoiding medications that unnecessarily suppress stomach acid. As a side note, if you have type 0 Rh negative blood, you are considered a universal donor. However, the only catch is that when you need a blood transfusion, you can only receive type 0 Rh negative blood, that is, blood from your own blood type. Type A blood group. The type A blood group, on the other hand, exhibits a profile that is the exact opposite of the type O group. Consequently, this group has a higher tendency toward clotting events. Research shows that deep vein thrombosis and cardiovascular issues are statistically more common in people with type A blood. Additionally, studies on cortisol indicate higher levels of this stress hormone. Chronic stress directly damages the circulatory system. Epidemiological studies suggest a potential link between group A and stomach and pancreatic cancers, likely due to inflammation caused by antigens. So what can you do if you're in this blood group? Avoid sitting still for more than 45 to 50 minutes. It may seem like a simple thing, but it's critically important for circulation. Stress management isn't just a preference for you, it's a necessity. In other words, it's a biological requirement. Don't forget to include foods rich in natural anti-inflammatory compounds like ginger, garlic, and turmeric in your meals. Blood type B. This group is known to be associated with a predisposition to vascular inflammation in 10% of the world's population. C-reactive protein serves as an indicator of inflammation in the body and is found at higher levels in blood type B. Over time, this can lead to peripheral circulation issues, that is, problems with the blood flowing from our heart to the extremities of our hands, feet, and body, and returning. Additionally, the antigen of blood type B facilitates the attachment of food foodborne bacteria like Salmonella and E. coli to the intestinal lining. Individuals with this blood type are advised to exercise extra caution regarding hygiene when consuming poultry and undercooked foods like eggs. So, what should you do if you're in this group? If your hands and feet are constantly cold, I recommend getting this checked out early. Eating foods rich in nitric oxide, such as beets, spinach, and leafy greens, can help relax your blood vessels. Additionally, being meticulous about food safety is crucial for your health. A B blood type. Let's move on to the AB blood type. This is the least common of the positive blood types, found in less than 4% of the world's population. According to a study published in a neurology journal, individuals with the AB blood type are more frequently observed to experience stress and memory issues compared to other groups. This is attributed to the simultaneous presence of A and B antigens, negatively affecting blood flow in the brain's tiny microcapillaries. Over time, these vessels' inability to provide sufficient blood flow to the brain can negatively impact brain cells. So, what should you do if you have this blood type? Cardiovascular exercise isn't just a preference, it's a necessity for you. Incorporating mental activities into your daily life is highly beneficial for cognitive development. Monitor your blood pressure regularly. High blood pressure in the AB blood group can have significant effects on your cognitive health. Taking care of your health is in your hands. Negative blood types. If your blood type has a minus sign, you can consider yourself part of the 13% of the world's population with this unique trait. The negative designation here stems from the absence of the Rh factor in your blood. In standard blood types, the presence of the Rh factor is denoted as positive. So, if your blood type is O Rh negative, it means your blood lacks the Rh factor. However, this can lead to a few complications. Pregnancy. If a mother with an Rh negative blood type is carrying an Rh positive baby, her immune system may perceive this as a threat. With today's technology, this critical issue can now be prevented with an injection called Anti-D. However, it's important to discuss this with your doctor and address it early on. Blood compatibility, meeting the blood needs of negative groups, is more limited compared to positive groups. If you have a scheduled surgery, one of the best solutions is to take practical precautions by donating blood in advance through what is known as an autologous donation. If you are in the negative group, carry a medical ID with you for emergencies, because in an emergency, time is a critical factor. Conclusion. If you have blood type 0, pay attention to your stomach health and inform your doctor about your blood type before undergoing surgery. If you have blood type A, avoid staying in one place for too long and make time to manage your stress. If you have blood type B, pay attention to your circulatory system, eat plenty of greens, and maintain good food hygiene. If you have blood type AB, you need to perform cardiovascular exercises frequently and incorporate mental activities into your daily routine without neglecting them. If you have a negative blood type, make an autologous blood donation before scheduled surgeries. And most importantly, carry a medical ID with you for emergencies. The medical system provides a general framework for everyone, but don't view yourself as just part of that general category. Understand your own biological differences and make more informed decisions. You can share your blood type in the comments to see if you share the same health profile with others of the same blood type. You can support us by liking our video and sharing it with your friends. Take care of yourself until our next video. Stay healthy.